Our basic knee assessment is fairly straightforward because it's pretty much flexion and extension that we need to look at, and usually extension isn't problematic. But to run through that quickly, you're just going to see, is there that ability for the knee to extend? It doesn't have a healthy knee doesn't have much extension anyway, but are we able to get that little bit extra here as we contract the quads? Or is that kind of locking? Is that uncomfortable? Is that eliciting the pain that you've been suffering with? But once we can get that tiny bit of extension through the knee, through both knees, then we're happy enough. More likely the issue is flexion. It's a bit awkward to test yourself, so ideally you'd have someone do it for you, but I'll show you the way we would do it. So you could use a strap like this at the ankle, and we're just basically passively pulling. Ideally we'd be getting heel to bum. I have a bit of room for improvement here. I tend to have tight quads, so our optimal passive knee flexion would be heel comfortably hitting the glute. But again, the main thing I'm concerned with is there a difference from right to left? Now, the next thing to try is, when we're lying down on our front and we're checking knee flexion, we're also putting a lot of tension on the hip. So maybe the restriction in the knee flexion is actually coming from the hip. So what we can do then is test our knee flexion when lying down. And again, this is easier if someone does it for you and you can be completely relaxed, but we want to see here, while there's slack in the hip, can I get the heel to my glute? And personally I find that a bit easier. So in my case, I wouldn't just want to target the knees and the quads, I also want to target the hips. So what you might find is that your knee flexion is quite limited when you're lying on your front, but when you lie on your back and you take the slack, or you put slack into the hip, then suddenly the knee is much better. And maybe you're suffering with knee pain, and that's indicating that maybe we want to target the hip more than anything. So obviously still do the knee mobility and the whole sequence here, but also work on the hip, and then as usual, knees, we're thinking ankles as well, because knees tend to get caught in between the ankle and the hip. So you want to address all of these things, but you want to have these objective markers, and mostly we want to know, is there a difference from right to left? Because again, they might be a bit restricted. Mine are a bit, I mean, there's room for improvement, there's nothing major, but they're equal, and I don't have knee pain or anything, so it's not a high priority for me. But if you're having knee pain, look at that. Is there a difference from the painful side to the not painful side? Maybe the not painful side is worse, maybe not. Just track it, just have a look, get these objective markers, take video, take pictures, have someone assess it with you, take down your results, and then do the mobility daily, check back in a week, 2 weeks, a month, and then again we're seeing progress and we're beginning to piece things together and we're beginning to make some positive change.